Hello and welcome to the State of Adolescents, Healthier Together. I am Ronald McNeil, President and CEO for the Georgia Campaign for Adolescent Power and Potential, affectionately known as GCAP. Over the past 3 years, we have reached thousands through our annual State of Adolescents panel discussions around emerging health issues impacting youth. We not only bring issues to the forefront, but we also have a responsibility to provide parents, youth-serving professionals, and youth themselves with the tools, resources, and solutions to address the issues. Today, for the State of Adolescents, we are bringing you a special single conversation with one of the nation's preeminent thought leaders and experts in public health, Dr. David Satcher. Dr. Satcher is a physician, administrator, and founding director and senior advisor of the Satcher Health Leadership Institute at Morehouse School of Medicine. Dr. Satcher served as the 16th Surgeon General of the United States and the 10th Assistant Secretary for Health. He also served as director of the CDC, and it is certainly worth mentioning that Dr. Satcher is the only person in our history who has served as both director of the CDC and as U.S. Surgeon General. Dr. Satcher, thank you so much for joining me today for this conversation. It is an honor and a privilege to talk to you about the current and emerging issues around adolescent health.
Thank you. I'm delighted to be with you. It's a very important topic.
Yes, sir. So I know we don't have a ton of time, so we're going to jump right into it. And I want to start with kind of an icebreaker question to get us going here. So my first question is, tell me about your fondest memory from your adolescent years growing up.
Well, I grew up in Anniston, Alabama, and went to junior high school at Thankful Junior High, and then rode a bus over 20 miles to Calhoun County because of segregation. So I grew up during the period of segregation. That's not my fondest memory, but my fondest memory is that I survived it.
Yeah, yeah. So, I think this idea that you just shared about segregation, I'm sure it was a foundation of why you have spent so much of your career focused on health equity and addressing disparities. As it relates to adolescent health, can you tell me, what are some of the equity and disparity issues that you think are relevant as it relates to adolescent health today? And are we making progress to close the gap and to address those issues?
Well, I think we're definitely making progress. Not enough progress yet, but I think we have to continue to work to make things better, especially for our people. And so we have come a long ways. A lot of people have gone into medicine, nursing, and people of color. And so on the one hand, we're happy that we continue to move in the right direction. On the other hand, we're sad that we're not there yet.
Yeah, yeah. So adolescence can be, a challenging time. From your perspective and your expertise and experience for a number of years, from a practical standpoint, what do you think that young people need physically, mentally, emotionally, to live a healthy lifestyle?
Well, I think the first thing that young people need to live a healthy lifestyle is knowledge. I think young people need to know what a healthy lifestyle is and how to best lead that kind of life. And I think more and more young people need to have that knowledge, but also need to feel rewarded when they lead a healthy lifestyle. And so I think we have two things there. Number one, the knowledge, and number two, the reward for leading a healthy lifestyle.
As we progress through kind of post-pandemic period, while we are certainly made progress as relates to that, there's a lot of emerging trends related to health that teens are having to face still. What are some of those challenges that you think are most pertinent to adolescent health right now? And how do you think parents and youth serving professionals and caring adults can help young people navigate those challenges?
We're talking about people who are at a point in their lives where they make a lot of very important decisions to smoke or not to smoke, to be sexually responsible or not to be sexually responsible.
Yeah.
There are several critical issues that young people have to deal with, and it's our job as adults, parents, and teachers, etc., to make sure they know how best to lead such a life. And to a certain extent that they get rewarded for it. In other words, young people ought to feel that if you lead a healthy lifestyle, you're going to be rewarded for it. You're going to be healthier. If you decide not to smoke, it means that you're going to be less likely to get lung cancer. We estimated that 1 million lives were saved after the Surgeon General's report on smoking and health. So there are a lot of rewards for healthy living, and I think we have to make sure that young people know that and that they're motivated to lead a healthy lifestyle.
You know, at GCAP, we are all about empowering young people to make healthy choices and arming them with the right information to help them do so. In the work that we've done over the last several years, you know, there's been progress and certainly greater attention to eliminate the stigma, right, around mental health and sexual health. And I'm going to come back to talking a little bit more about sexual health later with you. But as it relates to mental health, do you think we are at a point where stigmas have been eliminated related to mental health? And what additional work do we need to do as a community, as a state, to continue to put mental health at the forefront for our teens?
Well, let me confess my bias. I was the first Surgeon General to release a report on mental health. And of course, I was supported by a great team of people in the Department of Health and Human Services. Mental health is critical to overall health and well-being. Without your mental health, you're not healthy. And so we tried to make that point, and we tried to make sure that everybody knew the importance of mental health. Parents need to know it. It's nothing to be ashamed of if your child has mental health problems, because we have problems in all of our systems, not just the brain, but the kidney, the liver, etc. So in the report, we tried to say there are rewards to openly discussing problems with mental health and trying to reverse them if you can.
Yeah. What are some of the signs, right, that parents should look for? You know, I'm at a point in my life where I'm raising a 16-year-old daughter, and she moves about things a bit differently, right, than I did when I was her age. And sometimes as parents, we can miss the signs that are sometimes right in front of us. What are some of those signs that we should look for to know whether or not our child or a young person in our life needs support as it relates to their mental and emotional and social health?
It's a very important question, because young people do give signs. A lot of times they come later than we would have liked. But young people give signs that when they're in trouble, when they're having problems emotionally and otherwise, sometimes it's just the inconsistency of behavior that we first see in young people. And at that time, as parents especially, we need to stop and talk about it. But it doesn't just end there. I mean, our schools need to be openly talking about mental health problems. It's not just as things go wrong with the brain, just as they go wrong with the heart, the lungs, the kidneys, and the liver, they go wrong with the brain. They always have and they always will. The question is, do we respond, and how do we respond when things go wrong with the brain?
Yeah. One of the things we've tried to do at GCAP is give parents practical tools through our parent toolkit to how to have open conversations with their child about their overall health, their mental health, their sexual health. Sexual health, I know, is something that you are a huge proponent of. Yes. I read that you said that was probably one of the most challenging issues that you had to address during your time as U.S. Surgeon General. What is the state of sexual health for adolescents right now from your perspective? what progress have we made, and what barriers do we still need to overcome?
I guess on the one hand, I would say we have made and are making a lot of progress, but we're not there yet in terms of sexual health education, for example, to the extent that our schools are able to talk about sexual health. Then we have more young people who are comfortable in dealing with it and in talking with their parents about it. But the problem is that our attitude towards sexuality is as if it was another world, another language. Mm-hmm. But we have to get past that. We have to make sure that we create an environment where young people are comfortable talking about sexuality, and the parents also are comfortable talking with them. And that's not unrelated to mental health, by the way. Mm-hmm. When we released the report on mental health, we made sure that we followed that report with the mental health, culture, race, and ethnicity, we called it.
Yeah.
And it was to get into how does culture affect mental health? How does race affect mental health? How does ethnicity? And that was the follow-up report to mental health, a report of the Surgeon General.
Yeah. For those of us who are youth-serving professionals that's working with young people every single day, culturally responsive, tactics and practices are really important. Yeah. What are some of the things that we can do as youth-serving professionals, as those of us who just care about young people and spend time with young people, to be culturally responsive to their needs?
Well, you're to be commended in the first place, and let me say that we need more people willing to work with our young people, willing to engage them in these kinds of discussions. Because as I said, even the majority of parents are not comfortable discussing mental health issue with their children, and let alone taking them to the doctor and saying, I think my child may need some help because of a mental health problem.
Open communication is something a theme that I continuously hear you talking about in this conversation as it relates to our engagement with teenagers. I think for us as an organization, we have been making sure that these conversations happen in local communities throughout the state. What are some of the emerging issues that you see that we all need to be aware of and more cognizant of as relates to general public health?
Well, I think in terms of general public health, I like to go back and redefine the definition of public health because it's an important one. And public health is a coming together of people in a community to create the conditions in which people can be healthy. I mean, think about it, that's a very important definition, the conditions. Mm-hmm. We've got to change the conditions around us. If the conditions are unclean, if the conditions are unsafe, then we don't have the conditions for people to be healthy. So if we're committed to public health, we're committed to the conditions that allow people to be healthy. And often those conditions do not exist in communities. That greatly affects adolescents in terms of their perception of how important they are. Whether or not it's safe here, whether or not it's clean. And I am very concerned that more and more we're seeing violence among young people in our community. Atlanta is dealing with that issue. Safety is very important. Safety is important. You don't expect a child to leave home in an area that's very unsafe and go to school and just be safe.
Yeah.
They have to feel safe and supported by the community from which they come.
So I hear you talking about, social determinants of health, right? Mm-hmm. Safety,
right.
Food security, access to health care,
yes.
Transportation, which we know oftentimes is a barrier in some of the more rural,
exactly.
Parts of the state. But at the same time, where those disparities exist, I believe that communities also have value propositions that they can utilize to address some of these issues. Yeah. What are some of the most creative and innovative things that you've seen a community do or a state do, or even in our country that we've done to address, to ensure that those gaps are closed and that the social determinants of health are met for young people?
Well, I served on the World Health Organization's Commission on Social Determinants of Health, and we define the social determinants of health as those things, including where we live, where we grow up, how we learn, all of those things that affect what we are and what we have. So the social determinants of health are those things that we grow up being shaped by. And that can be violence, by the way. Very important social determinants of health, not a positive one. But one of the things that we're struggling with as a people right now is the violence. I tried as director of CDC to get the government to fund more programs that allowed us to attack violence at the community level. We had some outstanding people at the CDC in that regard, but they were not supported in that. Violence is a political issue also.
Yeah, yeah. And it's a challenging issue that has a lot of complexities and needs a lot of engagement, to address both locally at the state level as well as across the country.
Definitely.
So, as it relates to adolescent health, what can we do to continue to support young people as it relates to empowering them to make healthy decisions? You talked about knowledge, you talked about education. Beyond that, what are some other things that you think are important to help young people live a healthy lifestyle?
Well, I think we need to make available to young people the resources that make it easier to lead healthy lives. You know, we've had schools over the last several years that have discontinued physical education. And we've tried to say physical education is very important. If you say that you cut out physical education because you want to teach more math, you need to know that your math may be suffering because of lack of physical activity. So we try to get schools to see where these things go together, that regular physical activity promotes good health.
Yeah. Childhood obesity continues to be an issue for young people, and access to physical activity in schools is definitely a way to combat that. What are some things that community-based organizations can do as well to address those issues? What can churches do to address issues around childhood obesity?
Number one, I think churches and schools and others can identify obesity as a health problem. Obesity is a major health problem, and it discriminates in the sense that it's more of a health problem among African Americans than among others, and so we have to attack it aggressively. Obesity is associated with heart disease. Obesity is associated with diabetes, and I could go on and on. There are several things that say that we ought to be attacking obesity as early as it shows its ugly head. And because if we don't, then it's going to attack our children, and it's going to attack us more so in old age. I worked with the group in Georgia with the last governor who was concerned about obesity, and because of his concern, we were able to make a lot of progress in the state of Georgia. When we started, Georgia was in the bottom 5% in terms of control of obesity.
Yeah.
And that changed dramatically once we were able to get the schools, the communities, and others cooperating in dealing with the problem of obesity.
So I want to talk a little bit about policy and the role that policy plays in addressing these issues. We talked about obesity, we talked about mental health, sexual health. One of the major issues right now related to sexual health is the enormous spread of STIs and HIV, particularly in the metro Atlanta area and in other parts of the state of Georgia as well. What role does policy play as it relates to decision makers making sure that policy is aligned to ensure that people, particularly adolescents, are getting access to the health care as well as the education and information they need to address those issues?
Well, a very important question again. I mean, I think whether or not the policy supports health care is really critical. I don't know if you remember, but President Obama talked about the Affordable Care Act, and what he was talking about was the fact that uh, we're having an increase in mental health problems. People need to be able to get care, and it shouldn't be limited to their ability to pay. And so he got the Congress to pass the Affordable Care Act. Unfortunately, Congress ended up allowing states to opt out. And so states like Georgia and Alabama don't pay for mental health care for many people who need it. And until we get to the point where cost is not a barrier to care, then we're gonna be struggling. And that's especially true of mental health care. We need to really make sure that people have easy access to health care, especially mental health care.
So, I'm a citizen of, my this town that I live in, the city that I live in, a citizen of this state. But I don't know a lot about policy or what role I can play in changing policy, both at the local or state level.
Yeah.
What are just some practical things that our viewers could do to advocate for the right types of policy that address these issues?
Well, number one, I think education. I think people need to know the responsibility of elected officials to carry out policies that have been set for the state. And when people run for office, they like to talk about what they've done. And a good question for the community to ask of people is, what have you done for me lately? What is the policy
Yeah.
that you helped to pass? And therefore, how is the community better because of this policy? That's critical, but it's not easy.
Yeah. So, as we continue to do this work as an organization, GCAP, we are centered in partnership. I tell my team all the time that there's nothing that we do as an organization to empower young people without partnership. What are tell me about some of the most strongest collaborations and partnerships that you've seen over your time working in public health that you think are most effective and should be replicated to address health-related issues, particularly for young people?
Well, Georgia had one of the best, and I do want to comment on that because I certainly criticize Georgia when I think it needs to be criticized. But it was a partnership that led to a reduction in obesity in Georgia. It was a partnership between the state and the state health department and the education department. And a decision was made that every child that goes to school is going to have physical education K through 12. And that policy that led to fewer children having obesity in Georgia, and whereas before it had been the bottom 5% among states in terms of controlling obesity. It changed dramatically when that policy was made. So, and that's the most important thing that our elected officials do, is that they set policy.
Yeah.
They pass laws that change policy. Obama was trying to put forth a policy that would say the inability to pay will not be a barrier to getting care for mental health problems. And that was very important. You're never going to get everybody to agree. And some people run for office solely on the basis of the fact that they disagree with a policy that may be needed, but they can do that based on the politics. So I think when it comes to mental health, it's interesting that such a large percentage of health problems in our society are mental health problems. Now, that surprises a lot of people because we don't talk about it. We talk about diabetes, heart disease. I'm not saying we talk about them enough, but at the same time, we don't talk about mental health problems. And parents don't like to talk about it when their children have mental health problems, as I stated earlier.
Why is that, Dr. Satcher? Why do you think we have such trouble with just having a conversation about mental health?
Well, I think we have not discussed it enough. We don't hear enough about it in school. We don't see people doing things to improve mental health. So I think it's the environment that's now changing, by the way. Uh, I'm proud of the fact that during my tenure as Surgeon General, we released the first ever Surgeon General's report on mental health. It had never been done before. And I think that's a big beginning. It's not the end of anything, but it's a beginning when you decide that we're going to talk about mental health. We're going to make sure that every physician is trained in mental health care.
Yeah.
You know, I spoke at the Massachusetts Partnership for Behavioral Health 2 weeks ago. And one point I tried to make was when I was a medical student, um, the way people with mental disorders were dealt with was different than other disorders. And we had to intervene as students, and that's very important. We had to intervene and say, we want to see those patients too, because they're patients just like the other patients. So we've come a long ways in the last 20 years, certainly in the last 30 or 40, but we still have a ways to go.
So, teen pregnancy prevention, teen pregnancy in Georgia has been reduced by more than 70%. And, you know, GCAP really played a critical role at being at the forefront of teen pregnancy prevention and reducing the teen birth rate for our state. Our founder, she often says the best tool to address an issue like teen pregnancy is providing young people with hope. When you think about that concept and that idea, what are you hopeful about as it relates to health and wellness for young people and how that's going to play into the future of our state?
Well, I'm hopeful. Number one, now that we are talking about mental health, now that more and more people are having access to mental health care and not being embarrassed by the fact that just as things go wrong with the heart, the lungs, the kidneys, and the liver, things go wrong with the brain. I'm hopeful that that means that as time goes on, more and more people who need care are going to get it. They're going to get it on a timely basis, and they're going to get quality mental health care. That's what I'm hopeful about. I have to tell you, I grew up in an environment, including early part of medical school, where people didn't talk about mental health very much.
Yeah.
And to a certain extent, the students had to rise up. Just like, and of course, I came from Morehouse. And when I was at Morehouse, the students rose up to demonstrate against segregation.
Yeah.
You know, we went to jail, we went to prison because we thought that segregation was wrong, and it was. So when I got to be a student at Case Western, and the faculty told us that we couldn't go see the patient with a mental health problem, I wanted to know why. It was not original with me. I came from a place where students rose up to change things. And we don't talk enough about what those students did back in those days, but we should talk more.
You know, I think we're taking cues from generations before us around the power of youth advocacy and you young people taking action. One of the things that GCAP has established is the Youth Advisory Council made up of 20 plus young people, over 70 young people representing 20 plus counties across the state. And they are playing an active role in bringing awareness to health issues in their communities and talking about how it impacts them personally as well as their peers. How can us as adults, how can we support young people in their activism, in their quest to stand up, and their sense of empowerment, that sense of agency that they have to being change agents around health?
You know, that's a great question. One of the best ways to encourage young people is to respond to them when they approach us with their concerns and their problems. We can ignore it or we can respond and we can take action and make this world a better place. So I think that's what they look for from adults. They want to know that we're listening, and they want to know that we care about what they're concerned about. It's an interesting phenomenon, but it makes a big difference in the lives of children and young people.
Yeah.
It really does.
Just that idea of just listening.
Just listening and demonstrating that we heard.
Yeah.
Yeah.
Yeah. So, on the other side, there's a lot to be hopeful for. But what are some of your fears for our young people as they are navigating one of the most critical points in their life? That point of adolescence really sets them on a trajectory of how they will transition into adulthood. And so, what are some of the concerns that you have and the things that we as youth serving professionals need to be aware of to help young people with those concerns?
Well, I'm I'm concerned that, as you implied, that we don't always listen when young people talk, and uh, and therefore the message they get back is not a very positive one. Uh, some adults don't think it's their responsibility to listen to young people, because what do they know? They haven't been where I've been. But we need to listen to what their concerns are
Yeah.
and why do they have these concerns. And we can do that. We can do that without doing any harm. And so I think we've got to do a better job of that in the future. Uh, it's amazing. There are some things that are not discussed in the front of young people, and yet they discuss it among themselves.
Mm-hmm.
And so you don't make progress when you refuse to discuss something that's a barrier to progress. Violence is a barrier to progress. Irresponsible sexuality is a barrier to progress. And so we have to make sure we keep those doors open so that young people feel comfortable discussing them with their parents, with their teachers, and what have you. I know there are some communities that have gotten upset because teachers have discussed sexuality, but there is a place for discussing sexuality in our schools, and it needs to continue, but it needs to be done in a responsible way. And if teachers are not prepared to do it in a responsible way, we ought to better prepare them to do it in a responsible way.
So you talked about you reference irresponsible behavior related
Yeah.
to sexual health. Um, what role can we play in helping young people make those responsible choices, particularly now when we think about the overturning of Roe v. Wade? What do we need to be cognizant of, and how can we help young people make those healthy choices related to sexual health?
Well, I think in order to be safe, even, young people are going to have to make some tough choices. And obviously, the more they have to work with, the more choices they're going to have to make. So I think our young people are going to surprise us because they can make responsible decisions, but we have to make sure that we're supporting them. And that's the main thing. You asked me about the social determinants of health. And a colleague of mine, Dr. Daniel Dawes, who is now is the head of the Satcher Leadership Center, he just released a book called The Political Determinants of Health. As opposed to, or in addition to the social determinants of health, he said these are the political determinants of health. And when you think about it, to a great extent, politics is a great determinant of health because people, like I mentioned, President Obama's Affordable Care Act, great idea, but we also need to follow that by providing the resources to make possible mental health for everybody, regardless of the ability to pay. That was his goal. We are not there yet.
Yeah. So, what else is going on at the Institute? I know you've got lots of great work, a lot of things happening, and probably more in store. Share something with our viewers that you think is a relevant project that the Institute has going on, and maybe how they might be able to get involved.
Yeah, I'm really very proud of the work of the Satcher Leadership Institute. It started in 2006. We've had programs for parents with children under 5 years of age because we believe the more parents know about how children develop starting in utero, the better job they're going to be able to do as parents. So there are several areas in which we wanted to influence parent behavior, but we also have programs for community leaders, and that those programs are geared toward helping community leaders to be better leaders. We've had, I believe, 80 mayors to go through our program.
Wow.
Yeah, they come from all over the country to go through the program, and we've been able to help them in leading in their cities, and so we're very proud of that. So we're trying to prepare a better leader because we believe that leadership is important. We believe that if people are better leaders, we're going to have better communities, and I think we're demonstrating that. We also believe that we have the ability to get to leaders earlier. Students who are going to be leaders often know that they want to be leaders. And to the extent that they can get support, they're going to be better leaders. They're going to understand more about what it means to lead. And I believe that we're going to be, what's that, the poem, lives of great men all remind us we can make our lives sublime. And in departing, they leave behind for us footprints on the sands of time. Now, I forget who said that, but I know that it's one of the best poems ever written.
Dr. Satcher, you have shared a wealth of knowledge and information with us today. Thank you for all the advice that you share with me and with our viewers about the state of adolescence and the things that we need to do to address health issues for teens. The one piece of advice that you've reminded me of is that we have to listen to our young people more, listen to their concerns, but also listen to their ideas and even their solutions that they present to us as a way to address social issues, health issues, and whatever it is they feel most passionate about. So thank you for sharing that, and appreciate you so much for the support that you've given GCAP over the years and all of the knowledge and expertise that you continue to extend over at Morehouse School of Medicine. We're so grateful to be a partner with you.
I'm delighted to be with you, and I have great appreciation for GCAP. I'm not new to GCAP, by the way.
Sir.
And I have great appreciation for the work that this organization has done over the years. Jane Fonda, of course, I've known since the beginning of GCAP.
Yeah.
Really appreciate the leadership there.
And she sends her regards to you as well.
Very good.
Well, audience, thank you so much for joining us for this year's State of Adolescence discussion. Remember that we are here together to improve health outcomes for young people, and we all can play a critical role to ensure young people are on the path to a healthy and powerful future. Again, this is Ronald McNeil and Dr. David Satcher representing Georgia Campaign for Adolescent Power and Potential and Morehouse School of Medicine. Thank you so much for joining us today.